home issue today's order. The bottom line is that COVID-19 has been and continues to be a rapidly evolving situation, sometimes changing by the hour. That means that sometimes our responses have to change as we have more information. And if you're going to prevent and
aren't overwhelmed, then that means we have to be willing to act as quickly as we are able to do to keep people safe. And that's what's always going to be the bottom line for me, keeping people safe. Our deepest sympathies are with the families and friends of those who lost someone to this virus. I was struck by the profound statement from a family member of one of the deceased. This is a quote from his obituary. "We ask you to be serious about COVID-19. Please do not panic, rather educate yourself and your family. Please do not blame or shun, rather be supportive and compassionate, especially with the people who have tested positive for this virus." Now, I recognize that a lot of folks out there have had questions about the order, and I recognize this is a difficult time for our state and our country. At the end of the day, folks, we are all in this together. And during the most difficult times, we are called upon to remember our Wisconsin values of kindness, compassion, empathy, and respect. So to that end, I'm going to continue to ask for your help, not only to remember these values, but to do your part to keep our friends, our family, and frankly, most importantly, our healthcare workers and communities safe. We need folks to take the Safer at Home order I signed today seriously. Folks do not need special permission to leave their homes. You can still go outdoors, walk your dog, go to the doctor, go to the pharmacist, and get other and groceries, and get all the supplies that you need. But this is important. We need to have folks limit their interactions to the same people, not different small groups. Shrinking your circle of interactions will help prevent the spread of COVID-19 to make sure our healthcare system doesn't become overwhelmed. Unfortunately, that means no potlucks, no play dates, and no dinner parties. And if you have to leave your home, please stay 6 feet away from other people. As I also mentioned yesterday, some businesses will continue to be allowed to operate. So no need to run to the grocery store and hoard food. Healthcare operations, grocery stores, pharmacies, gas stations, banks, critical infrastructure, and businesses that ship and deliver groceries and foods and goods directly to residences, among others, will continue to stay open. Over the past several days, we've been working with public health experts, local governments, stakeholders, business leaders, to determine how we can best keep folks safe while continuing to provide the essential services and keep our economy strong. If you have questions about whether your business is essential or non-essential, please review the Safer at Home order. And if you have any additional questions, please visit wedc.org/essentialbusiness for other details. In addition to our Safer at Home order, we are also working to ensure that our healthcare and essential workers have access to child care in Wisconsin. Last week, my administration convened a broad group of stakeholders to determine what child care options were available to healthcare workers and what child care needs existed within the healthcare community. Over the past 48 hours, we've begun connecting the dots for those folks with child care givers. We also put into motion the plans for new on-site child care facilities. I fully expect the coming weeks to see these operational. These are operational in areas of high demand. Now, I just have to go back and talk about one thing in particular. All this is about making sure that our healthcare workers, our emergency responders, and others that are helping save lives and prevent this virus from expanding to do their work. It is very important. And I also want to thank some people that are helping us in doing that. So I want to acknowledge a few key partners: the Wisconsin Hospital Association, the Wisconsin Early Childhood Association, supporting families, Together Association and Registry, and staff and leaders from DHS and DCF. I want to give a big thanks to the child care providers who are keeping these kids healthy and safe and adapting to this rapidly evolving situation. On a separate note, I'd like to thank the Wisconsin Dental Association that has offered personal protection equipment, which includes 20,000 masks, 25,000 gloves, and 1,700 gowns. We are coordinating with the Wisconsin Emergency Management System to arrange for the transportation of this material back to a Madison warehouse for redistribution to facilities in need. So I want to thank all the folks who are generously working to help us get the supplies we need to our healthcare workers and systems across our state. And now I'd like to introduce Secretary-Designee Andrea Palm from the Wisconsin Department of Health Services. Andrea?
Thank you, Governor. And thanks to everyone for joining us again today. I'll start with where we are. We have 8,237 negative tests, 457 positive tests, and we remain at 5 deaths in the state of Wisconsin. Today, as the governor mentioned, he did direct me to sign the Safer at Home order, which I have done. As the governor said, this decision was not made lightly, but it has become necessary to stem the tide of COVID-19. It was made by listening to the advice of our public health experts, and it is abundantly clear that you are safer at home. I've heard some people question why we're doing this when there are only 457 cases and 5 deaths in a state as large as Wisconsin. Our state benefits from the experience of others who have come before us in this pandemic. Our experts are comparing our data to the Wuhan and Italy experiences to predict what is likely to happen here in Wisconsin. And if we continue on our current path without implementing Safer at Home to flatten the curve, the models show us that we would likely have 22,000 Wisconsinites who are positive for COVID-19 by April 8th and an estimated 440 to 1,500 deaths. This means thousands of Wisconsinites would need hospitalization, and we would exceed our current capacity, our current hospital bed capacity. Yesterday, we heard from the Wisconsin Hospital Association, the Rural Wisconsin Health Cooperative, Leading Age, the Wisconsin Healthcare Association, and others representing frontline healthcare and long-term care providers, urging the public to take all steps available in order to help manage the limited resources they have to take care of patients during this pandemic. Keeping our healthcare system from becoming overwhelmed is our #1 priority. Remember, there are no medications or vaccines to protect us from this contagious virus. The only tool we have is physical separation from each other. I implore you, stay at home. We have to stop this virus from spreading any further. Limiting your contact to less than 5 people total will help do that. Not 5 people at a time, but 5 people total. So that means, as the governor said, no dinner parties, no sleepovers, no kids at the playgrounds, no gatherings. We need you to be in physical contact with as few people as possible. And I think I would just drill down on that just a little bit. As we learn more about this and we understand that transmissibility happens before symptoms, this physical separation, this working to be in contact with as few people as possible becomes more and more critical because we don't necessarily know who is positive and therefore who is spreading it. While you are safer at home, the Department of Health Services, along with the governor, the State Emergency Operations Center, and our private sector and healthcare partners are working together to prepare for what is ahead of us. We continue to trace every confirmed case of COVID-19 to find anyone they may have exposed and inform them so they can go into isolation. Isolation not only means staying at home, but staying in a room that is away from other members of your family so that they are not exposed to COVID-19. This critical public health work will allow us to isolate any people who are potentially exposed, and will stop them from spreading COVID-19 to others. To help us do this critical work, we have redeployed 60 public health professionals to aid our local public health departments in this effort to do contact tracing. As the governor mentioned yesterday, contact tracing is just one of the 6 strike teams we have been working, that we have stood up to be working on our biggest challenges that we're facing with the COVID-19 pandemic. The other strike forces working at the State Emergency Operations Center are focused on surge planning, on personal protective equipment and other essential medical supplies, our lab capacity, isolation facilities, and finally, as you heard from the governor, childcare for healthcare workers. The Department of Health Services, doctors, nurses, public health officials, and other staff across the agency are working with our healthcare system partners, leaders from Epic Systems and the National Guard to plan and execute this work within the strike teams. There will be more announcements from them in the coming days. While we continue to focus on that work, one thing I'm asking of all of you today is to make some time and think about how you and your friends and family are handling safer at home. This is hard. Humans are social beings. We're not wired this way. And this COVID-19 pandemic and the resulting changes in your life and your lifestyles can make anybody anxious and even depressed. Do not hesitate to ask for help if you're feeling overwhelmed. Some resources that we have available: call 800-985-5990. Again, that's 800-985-5990 to speak with a trained crisis counselor, or text "Talk with Us" to 66747. Other resources to maintain your mental health and well-being can be found on the DHS COVID-19 webpage. And we will certainly continue to talk about this issue moving forward. But also you can call and check in on people, see how they're coping, FaceTime with grandma, Skype with your neighbor, Google Hangout with your friends. Stay connected to your support system, because we are going to need each other to get through this, but we can do it together. Thank you almost seems inadequate in expressing our gratitude to our partners who are working alongside us to flatten the curve, especially our diligent local health and tribal health officers and our healthcare providers who are on the front lines of this pandemic. The same can be said for private sector partners, business leaders, and business owners who have been so willing to help and have stepped up to ask how they can contribute to the efforts. But our deepest sense of gratitude is for the citizens of Wisconsin. As I said earlier, nothing we have asked of you or will ask of you has been decided without careful thought and deliberation. And true to this state's spirit, you have risen to the challenge each time. We will get through this. It will take some time, but there will be a day when you can go back to work, your kids can go back to school, we can shop, go to the movies, and do all those things that make our lives richer. Like you, I look forward to that day. Until that day comes, thank you again for all that you are doing. We will continue to be transparent and provide timely information as this crisis evolves. Please be safe.
Thank you, Secretary Palm, and good afternoon. I'd like to share some updates related to our public health response and describe some of the issues that we're working on in partnership with our healthcare partners during this very challenging time. First, wanted to correct something that I mentioned in yesterday's briefing that was inaccurate. I'd said that we had about 10% of individuals tested positive for COVID-19 that were hospitalized. In reality, we believe that number is higher, probably as high as 20%. And the reason for that discrepancy is that the way that we collect information about positive cases comes directly from reference labs rather than hospitals themselves. So we've learned that in a lot of cases, the information about whether a patient is hospitalized at any given moment is missing. So what's one of the things that we're really working hard to do is to develop new, better, and innovative strategies to look at a large number of data sources so we can keep very close track on the critical health system resources and understand exactly who is hospitalized and who's requiring critical care. There are two important things that we've learned from research about the virus that I think need to be underscored to really talk about why this is such a grave situation. The first is the very high proportion of individuals who contract the virus who will have mild symptoms. So that's good news and bad news in the following sense. We've learned from other countries that as many of 90% of people who have the infection don't require symptoms that require medical care. And so since we've generally test people in the setting of a medical evaluation because they have symptoms, that could mean that for every individual that we test that tests positive for the infection, there are 10 individuals in the community with mild symptoms that don't seek care. So we're having a small number, hundreds of cases in the state, but it would potentially be thousands right now. And there's potential that people will develop increasing or worsening symptoms in the future. That's another thing that we've learned about the virus, is that sometimes initial mild cases can become more severe. The second thing we've learned about the virus is that it's very highly transmissible, even from people who have mild symptoms. When we've studied the data from the other countries in terms of the speed and the size of the outbreak, we've learned some of these important parameters about this epidemic. The first is the reproductive number, or how much we expect, how many additional cases we expect to become infected for every one case. That number is between 2 and 3, which means that for every person we might have 2 to 3 more people infected. Other parameters around that we talk about are in terms of the doubling time. How long does it take for the number of people who are currently infected to exceed it by a factor of 2? And that number in other countries has been around 6. But we've seen in this country and other states that the number of cases reported in some states has doubled in as few as 2 to 3 days. So we're very concerned, as the Secretary mentioned, with some of these modeling, that this could develop much larger very quickly, and it's really why that's really the justification for the measures that we're talking about. So the science is pretty clear that the measures we're taking for the entire state in terms of limiting our physical contact is really the main tool that we have to address the crisis, and if we do so well, we can save many, many lives. The last thing I really wanted to echo that we're addressing and really focusing on in public health is that these social distancing measures that we're recommending are themselves not without risk. So to use a medical analogy, many times the treatments that we prescribe for disease have a risk of side effects. You know, in cancer care, we can cure very aggressive tumors, but the treatments that we required sometimes make people feel quite awful and can be very toxic. So the intervention that we're recommending for this pandemic recommends isolation, social distancing. Social isolation can be very toxic for people. It can make people feel awful. So we really want to draw increasing attention to the idea that while we need to have physical distance between people, we want to do everything we can to stay socially connected, and the resources that the Secretary mentioned are great examples of this. In healthcare, we're also really focusing on using innovative tools in telehealth and telephone-based interventions to make sure that people feel connected to their source of medical care, particularly in mental health care. Finally, I just wanted to echo the sentiment that the Governor and the Secretary mentioned and just to express our profound gratitude in those of us working in medicine and public health. I acknowledge it's difficult to really conceptualize and see what a historic threat this is when we have such small number of cases, but that we've learned enough about the virus and we've observed enough about the epidemic in other countries to know that this is truly a grave situation, and all of the things that we're recommending we understand are not easy. And if we do them well, they're going to seem like tremendous overreactions, because that's going to mean that the virus, the epidemic, did not get too far out of control and become too large. But that's really our goal, and we really appreciate the support of everyone as we get through this together.
All right, thank you. We'll now open it up to questions. A reminder to maintain the audio quality, to keep your phones on mute until it's time to ask your question, and only one question per reporter today. We'll begin the questions with Bram Sable-Smith from Wisconsin Watch. Bram? And a reminder.
Hello, thanks for taking my question, and thank you for keeping the communication lines open. My question is for the Governor. So physician assistants in the state say that they're poised to provide assistance right now, but they're restricted due to certain regulations on them, like supervision requirements and scope of practice restrictions. and they're asking for certain administrative codes and statutory changes right now. And the question is, will you or are you considering making those changes?
I know our Department of Safety and Professional Services are looking at a wide variety of regulations that impact not only the healthcare community, but also various essential industries in the state of Wisconsin. I know we're working on it. I don't know if, Andrea, have you heard anything recently on that? Anyway, yes, we are looking very actively at all issues relating to the ability of us to relax regulations in this circumstance.
Thank you, Bram. To Sean Johnson from Wisconsin Public Radio. And a reminder, *6 to mute and unmute your phones. Sean Johnson from Wisconsin Public Radio. Okay, we'll move on then to Sean Kirkby from Wisconsin Health News. Sean?
Hi, thanks for taking my question. I was wondering why April 24th is the date, and are you looking to expand that further? Thank you.
April 24th is the same time that our original emergency declaration was made. It's the same time, and this particular order is to expire at that same time, unless a subsequent order overrides that. So it's connected with our original emergency order.
To Alex Moe from West Politics. Alex?
Thank you for taking my question, and my question is for the governor. Yesterday's announcement about the safer-at-home order caused some confusion and uncertainty, especially among members of the business community that weren't sure if they would be shut down. My question is, why did you release more specific details about the safer-at-home order yesterday?
Because we were in the process of collecting that information and creating that list. If we had that list yesterday, we would have released it yesterday. We have it today. It's clear that, and I just want to talk about the essential businesses that we see on that list, just to have people understand why it's an expansive list. If we can just think of the agriculture industry, for example, obviously our farmers are the linchpin of that, but there's a supply chain that keeps that farmer in business, and so there's all sorts of people that supply goods and services to that farm so that he or she can provide that product for the market. So there's a large group of people that are essential there. Obviously, as I said before, the farmer, him or herself, is a linchpin to that. And then we have the issue of transporting the farmer's good to market. That there's all sorts of essential industries that take place there. Going to a processor, the goods and services that are provided to that processor in order to make the food to send it to market. That transportation system taking it to market has essential industries too, and then we have the place where food is sold at the grocery stores. So the one thing we found about this is, and we knew this going in, the complexity of the supply chains of this state are immense, and also it's a recognition that our industries in the state of Wisconsin are really strong in that these things are intertwined. So the economy of our state is based on various industries, and so it took a long time to work through each of those supply chains. That's why it took so long. If we would have had that information yesterday, you would have got it. You got it today.
Thank you, Alex. To Scott Bauer from the Associated Press. Scott?
Hi, thanks for taking my call or question here. Governor, I didn't see anything in the order related to allowances for the election on April 7th. Is this a sign that there will not be in-person voting on that day?
Well, I know that's something we're continuing to work on, but I just have to say at the outset, what we do know is that the simplest way to vote is either as an absentee vote or early voting. My wife and I have been voting for 47 years together. It's usually a date night, go out to eat afterwards and celebrate our democracy. This is the first time that we have had the opportunity to vote absentee, and it's easy to do. You go online to myvote.wi.gov, and make it happen. It took a couple minutes for both of us to make that happen. So what my message is this: we're working hard to understand the issues of what's happening on April 7th. But what we do know for sure is that it's easiest to do is just go online, making sure that you have that ballot at hand. I don't know, Ryan, if you have any other items that you'd like to add to that.
No, I think that covers it in terms of, we're looking at all the options that are available, but as the governor said, there's a very easy and safe method for people to participate, and that's why we continually encourage people to vote absentee. And a lot of folks are taking full advantage of that. We're seeing record numbers of people request absentee ballots, and there's still plenty of time to request your absentee ballot, and everyone should do it today.
Yeah, and we're working regular, it's nonstop calls for me with local leaders in cities and municipalities, as well as the Wisconsin Elections Commission. We're all working together to make sure that people are safe and that votes count.
Thank you, Scott. So Will Cushman from Wiscontext. Will?
Hi there. Thank you for this call. My question is for the governor. I'm wondering if an employer is deemed to be essential, but an employee for that employer does not feel safe going to work, do they have the right to stay home under this order?
Well, that's certainly a conversation with that business owner and that employee. I believe our employers in the state and our employees have good working relationships, and that they can figure that out at the business level. I would encourage business owners, however, to understand the seriousness of the situation, and an employee that is uncomfortable and concerned should, we may have to make, you may have to make some accommodations for that employee.
To Megan Carpenter from Spectrum News 1. Megan?
Hi, thank you for taking our questions. This question is for the governor. Just a response from you, sir, about Mayor Barrett asking that the election on April 7th be completely mail-in and not in person whatsoever.
Well, I didn't hear the conversation, so it's difficult for me to respond to something I haven't heard. But certainly, I am in regular communication with Mayor Barrett and other mayors and voting officials across the state. We all have one thing in common. We want to make sure that we have a good vote, and that we have safety as a top priority during that good vote. We're going to continue to work with our mayors and the Election Commission as it goes forward.
To Will Cornelia from PBS Wisconsin. Will?
Hi, can you hear me?
Yes, we can.
Thank you. So we hear a lot about trying to flatten the curve with schools and businesses closing. If these measures are working, when will we expect to analytically see that flattening happen?
Dr. Westergaard, do you want to?
Sure. As I mentioned, we have a limited window into the number of people who are infected with COVID-19 right now. It's almost certainly quite a bit larger than it is than the 450 cases that we have. So, assuming that there's people infected right now that we're going to develop symptoms in the coming weeks, I think we would expect under any circumstances for the numbers to continue to increase over the next coming weeks. But I think after that point, if we don't see growth of the epidemic, we see a leveling or a tailing off, I think that'll be the sign that things that we're doing are successful. What we know from other places that experience the epidemic sooner, is that when we go about our normal business, the epidemic grows exponentially. And that's what we're starting to see in some areas of the country, with doubling of the case counts every several days. So we want to see that not happen is going to be our clue. Even if we do everything right, I think we might still see doubling of the numbers that we have in the foreseeable future in the next week, but the peak would come much sooner. So I don't think we're going to see a tailing off today or tomorrow or this week, but the idea of over the next several weeks, we're going to see the absence of a large expansion. That's really what we're going for.
Thank you, Will. Now to Eric Gunn from Wisconsin Examiner. Eric?
Thank you. Can you speak, if any one of you, to the sentiment that is being expressed in some places that the severity is worse than the disease because of its effect on the economy?
I'll just do it from a 30,000-foot level. I've heard that argument, and especially at the national level. Safety is always, I mean, obviously we want a strong economy. Who the hell doesn't? But the fact of the matter is, if we have to value human life at some point at a higher level, I think we can do both, and that's what this order is all about. We have to respect the healthcare providers. We have to respect the scientists, and that's what we're doing here in the state of Wisconsin.
Thank you, Eric. To Austin Montgomery from the Beloit Daily News. Austin?
Hi, thank you for taking my call. My question is either for Dr. Westergaard or Secretary Collins, just in regard to the COVID-19 modeling that was referenced earlier. What's the start date used in that modeling from China and Italy? And will that be made available online?
So I'll let Dr. Westergaard speak specifically, but I think in addition to what he'll say, I think it's important to know that there are lots of smart people around the country who are looking at these questions. Harvard, for example, put out some modeling earlier this week or last week. I lose track of time. But lots of folks are looking at these questions, and sort of no matter who those smart people are, what they're telling us is that if we don't double down, if we don't take more aggressive action to slow the spread, we will exceed the capacity of our healthcare systems, and we need to be doing everything we can right now to prevent that from happening.
I think that was well said. I don't have any other specific details other than to say that the number of models are all publicly available. The research groups that have done these make their source code available and actually have some data visualization dashboards to be able to look at these things under the different conditions of the types of and degrees of social distancing interventions. So those are available online.
Thank you, Austin. To Mason Dowling now from WAOW TV in Wausau. Mason? WAOW? A reminder, *6 to mute and unmute your phones. We'll move on then to Shelley Nelson from the Superior Telegram. Shelley? Shelley Nelson?
I am wondering, with the necessity of moving everybody to essential travel and stay at home, why not close the polling places at this point? When people still have time to get their ballots and will start thinking about getting their ballots.
Great question. We, as I said, we are evaluating and having conversations with municipal leaders, as well as the Wisconsin Elections Commission, and so that conversation's ongoing. But I can't say this often enough, so I'll say it one more time. You can early vote right now. You can certainly do an absentee ballot. It's easy. It's so easy that I did it. And so we can worry about the issue of the polling places, and we are worrying about that. But at the end of the day, right now, you can vote. So please do that.
Thank you, Shelley. To John Ellis from WDIO in Duluth. John? John Ellis? Okay, we'll move on then to Jessica Van Egeren from Up North News. Jessica?
Hi, this is Jonathan Sadowski from Up North News, just filling in for Jessica. My question is for Secretary Palm. So you kind of mentioned that it's easy to her that we $3,000 affected by April 8th, up to, 1,500 deaths. What are we expecting now, with the safer at home order? What are the models saying there?
Is that something you can?
It really, the impact that these will have on the epidemic really depends on how well they're executed. The study that's most commonly cited is one from Imperial College London, which compared sort of the most aggressive implementation of social distancing, which was actually done in the Wuhan province where it was done, and it really led to a pretty rapid attenuation of the virus spreading within a matter of weeks. So that's the best case scenario that we have, is to say that if we were 100% effective, if we limited social interactions or physical interactions with people completely, knowing about how the incubation period of the virus and the duration of illness, within several months we would stop seeing many new cases. Now we know that perfect scenario is impossible because people have to do essential things. So the matter is how close to that can we get by implementing all of the precautions that we're talking about. And we're particularly concerned about transmission in households and healthcare settings, because when we identify people with the infection, we have to provide care to them. We have to be involved enough so we, in addition to the large scale sort of whole community-wide interventions, we really want to focus on the issues about personal protective equipment, infection control in healthcare settings, and try to support people to do isolation and quarantine in the community as well. So it's really a moving target. We know, are confident that we can really severely stem the spread of the epidemic if we did it very, very well. The question is how well can we support people to do these interventions that we're talking about. And our hope is that and this is the whole response is really aimed at doing these things effectively.
So Ryan O'Connell now from the Rice-like chronotype. Ryan? And a reminder, star 6.
Thanks for taking my question. How will the physical supplies of PPE and ventilators, either from state packages or federally rationed, distributed through the 12 states as a COVID-19 situation progresses?
So, I guess as a foundational point, there are not surplus supplies of any of these things, of PPE, of ventilators, and in fact, we do not have enough. And so we have been working aggressively across the government with our private sector partners, with our federal partners, to work to get our hands on more of the supplies that we need. The governor mentioned that the Dental Association graciously has donated some extra PPE that will be redistributed to the front lines, so that healthcare workers and emergency responders have PPE, but we continue to work very hard to secure supplies of these needed medical supplies as quickly as possible. But it is a national problem. We are not the only state that is desperately working to improve our access to PPE and ventilators, and we will continue to do that.
Yeah, and I'll just jump in. This is Governor Evers. I think it's important to recognize that the federal government does have a role to play in this. We're hoping that they will take a more active role in coordinating this. It makes no sense for New York and Wisconsin and California and Illinois to be competing with each other for supplies. And so hopefully in the very near future, we will have a more active federal government in this area. Clearly, and I said this before, I was happy when the president passed off the federal role to the emergency management department of FEMA of federal government. That was a good step forward, but they need to take a more active role, and I'm hopeful that they will, because just competing against other states for scarce resources is a problem. In turn, I've been very happy with the response of various industries here in Wisconsin that have stepped up in a big way to help us. But we have a supply shortage. We need some coordinated efforts from the federal government also.
Thank you, Ryan. To Matt Piper from the Sheboygan Press. Matt?
Okay.
Is anybody advising stricter measures in the safer at home order? And is what we see at all the results of these weighing that advice against the economic consequences of a stricter order?
Yeah, we did consult lots of people on this issue, and as I said before, the public health community and scientists of the state are the ones that I rely on most directly. But we also did spend time, obviously, with local officials, municipal officials, but lots of people from the business community who provided us great advice. And so we came to a place where we feel comfortable that we can aggressively address this, but still have those essential services being offered, and making sure that everybody in the state of Wisconsin is protected as well as possible. Of course, there's we can lock down like other countries have, but we're part of the United States of America. We have we're surrounding states and that we interact with on a regular basis, and so we felt comfortable that we are consistent with surrounding states and comfortable with us being proactive and slowing down the disease while at the same time keeping essential services going.
Thank you, Matt. To Adam Rogan from the Racine Journal-Times. Adam? Adam Rogan? Then we'll move on to Maddie Heim from the Appleton Post-Crescent. Maddie? And a reminder, star six. You're passing? Okay. To Amber from WLUK in Green Bay. Amber Luckett? WLUK? Okay, to Rob Sussman then from WTAQ Radio in Green Bay. Rob?
And I'll just start out, and then I'll pass it back to Dr. Westergaard. We obviously are taking interests of businesses in place. We have, if you look at the list of essential businesses in the state, it's a vast majority of our state's employers. But that said, I also understand that small businesses across the state are struggling. If you look at restaurants and bars, clearly this doesn't make their life any easier than it did 2 days ago. What we're doing there is working very diligently with our national counterparts to make sure that resources are made available to those small business owners. Our Wisconsin Economic Development Corporation has put their full force of their workforce heading into this to make sure that resources are available. We have a small business authority loan program that we had approved. The WEDC board has approved resources. We're going to hopefully be doing some things at the state level in a bipartisan way. We will make sure that we keep those small businesses as healthy as possible. I know they struggle. And their workers struggle. most of the people in Wisconsin are employed by small businesses, and many of them are now receiving and will receive soon unemployment insurance payments. We pushed back the income tax deadline date. We're doing whatever we can to make sure that the upshot of keeping a healthy Wisconsin does not impact anybody in a severely negative way. It calls for sacrifice, no question about that. But we are working to make sure that at the national level and at state level, we are helping those small business people. Main Street businesses are the ones that are most at risk here, and I understand that. Now, I know you had some other questions medically oriented. I'll pass that off to Dr. Westergaard.
So on the medical public health side, it's an extremely important question. You know, COVID-19 right now in the country and the globe is really our most urgent public health issue, but it's not our only public health issue. People who are going to be staying at home more also have other chronic medical conditions, and people have underlying mental health vulnerabilities. And our systems, on the healthcare system, need to be prepared to meet those needs in a different way than we have in the past. So we're really encouraging and trying to support and disseminate best practices about telehealth, telephone-based care. We're trying to develop at the state additional resources to do telephone-based triage to make sure that people can stay connected, and so that their ongoing medical care needs get met on an ongoing basis. So it's something that we're really focusing on through this situation.
Thank you, Rob. To Addie Bink now from WFRV in Green Bay. Addie? Yes, we can.
Great. My question is probably for the governor. We were just wondering, what about those people that have to make rent payments and mortgage payments during this time? Maybe they're without a job right now. Is there anything being done for them?
Absolutely. Our Department of Financial Institutions and our other departments that deal with the finances around mortgages and so on are working with that group of businesses to see what can be done. Certainly unemployment compensation, unemployment insurance is important and will help people make those payments. In addition, we're counting on our federal government, and as I walked in here today, I think we're getting close to having some resolution to what the federal government can help us at. So, of course, every one of those resources will be necessary in order to make sure that people are treated fairly and that payments can be made.
To Sarah Thompson now from WBAY in Green Bay. Sarah?
Good afternoon. This question would be, I think, for the governor. We've heard from some people, some law enforcement, as well as some healthcare workers saying in their opinion that they think that these restrictions don't go far enough. Obviously their opinion, but is there any chance that this would that there would be a curfew in place or tightening of restrictions, and if so, how long would that take?
Well, as I said when I started out today, my comments were I didn't want to get to this point, and that it's a fluid situation, and that at the end of the day I will always rely on the advice of our public health officials and the scientists that are providing us advice. So the answer to your question is I don't believe we will be there, but we monitor the situation 24/7. If we need to make other changes down the road, we will do that in order to make sure that our healthcare system continues to be strong.
Thank you, Sarah. To John Neiser from NBC 26 in Green Bay. John?
This is related to the safer at home and enforcement. What have you directed law enforcement to do in terms of taking any action related to citations or anything like that? Is there a buffer period, or is this kind of going into effect right away?
I'll turn that over to Ryan.
So the safer at home order, there is a buffer period before it goes into place. And so it gives both, people enforcing it, which would be local law enforcement officials, but then also businesses in the state of Wisconsin time to comply. So it doesn't become effective until 8:00 a.m. on Wednesday, March 25th. And so that will give folks time to understand what it requires. Yeah, the same has been mentioned by Secretary Palm earlier. With this needed, we couldn't have too much time in order to have this go into effect because of how the curve is looking. And if we're going to be able to put a stop to the increase in cases of COVID-19, we needed to do additional restrictions sooner rather than later.
Thank you, John. To Mitchell Schmidt now from the Wisconsin State Journal. Mitchell?
I was curious, you mentioned a little bit about unemployment insurance. We're hearing from...
Mitchell, your signal is very bad. Can you...
That they're having challenges either getting through or facing long wait times. Is there any effort being taken to address that or, and piggybacking on that, giving sort of a message for anybody out there who's maybe looking for work?
Sure, and unfortunately, there was a really horrible reception there, so I didn't get the whole question. I know it was about unemployment insurance and some of the difficulties. We had tens, I can't remember the exact number, so I won't say it, but a whole bunch of people that called yesterday morning. The system went down for a short period of time, and we got it up in mid-morning. So it's my observation that we're doing well. We've redeployed people from all sorts of state services to the unemployment insurance workload that has been created at the Department of Workforce Development. So we will continue to do that and get people the resources they need. It's obviously a top priority. If you think about who has been most impacted by this thus far, it's been our service workers, service industry workers who aren't necessarily all that well paid, and they are ones that need our resources from the unemployment insurance system. So we're doing everything we can to make it work, and it's my belief that we've got the resources in place, but we're going to have to continue to increase those resources.
Thank you, Mitchell. To Emily Fannin now from WKOW-TV in Madison. Emily?
Hi, the order says police and sheriff will enforce this order, but how exactly will they do that? Will they be patrolling the streets? Will people be stopped and asked why are they out of their homes? Can you tell us what this will look like?
Sure, I can answer that question. So it's going to vary jurisdiction to jurisdiction. No, people will not be pulled over and asked. The order does not require people to have certifications or to have proof that they're on essential travel. That said, we do hope that because of the urgency of this situation, that everybody does their part and chips in, that they take this situation seriously, and that they stay at home as much as possible. And local law enforcement is there in certain situations when there's complaints or they get calls about noncompliance. But again, this situation really demands that we all do our part and chip in. Voluntary compliance is what we do best here in Wisconsin, doing the right thing, and that's what we hope people will continue to do.
Thank you, Emily. To Amy Reed now from WISC. Amy?
Can you hear me, please?
Yes, we can.
Can you hear me, please? Mm-hmm. Thank you. So my question is to the governor. You've been encouraging absentee voting and trying to keep this process much safer. We're hearing from a few people, quite a few people, that are isolated, quarantined by themselves and are worried about the witness signature requirement on an absentee ballot. Is there any discussion to potentially waive that requirement for this election, or how else would you respond to these people that are worried about that kind of interaction in order to get that signature?
Sure, I can answer that question for the governor. As the governor said earlier, we're looking at all of the options that are available in order to make sure that people can participate freely and safely in this election. And there are some hurdles that the current law provides, as you mentioned, the witness signatures, especially for folks in isolation. So that's something that we're currently evaluating to see what we can do. And that definitely does apply to a fair number of folks. But that said, you know, for the rest of us, again, it just shows why it's so important that people today take full advantage of voting absentee. Going on to myvote.wi.gov, as the governor said, it's an easy process to do. And for the vast majority of us, we can take care of it today and fully participate and safely participate in the spring election.
Thank you, Amy. To Shali Pittman from WORT Radio. Shali?
Hi, Dale Brogan filling in. Governor Hebert, what guidance are you giving county governments in regards to running jail facilities during this public emergency? And who are the 5 people in your close circle mentioned by Secretary Hall?
I'm sorry, what 5 people are you referring to? I'm asking Secretary.
Around 5 people, so who are your 5 people?
So the recommendation, Governor, is not in groups of 5 or less, but the same 5 people to limit.
Yes, my 5 people are Kathy Evers and Ben Belzer, who is one of my assistants, and myself. It's a pretty small group.
Thank you for that, Dylan. To Taj Mahal from WMTV NBC 15 in Madison. Tajma?
When a person tests positive, are they required to let their employer know, or does DHS do that? How do we make sure that that contact tracing is accurately being counted?
So when somebody tests, this is Andrea. When someone tests positive, that test is notified to their healthcare provider as well as the local public health department, who reaches out directly to them. I assume the provider does as well to give them their test results. But the local health department, our boots on the ground, reaches out directly to them. They interview the person to find out all the other people that they have come in contact with, so that those folks in turn can also be contacted. We can figure out what sort of risk they are to that exposure. Are they more or less likely to contract the disease based on the type of contact they had with that positive case? And it goes from there. And so if this positive case was at work, after they were positive, the employer may, or employees who were in contact with that person might also be reached out to by local public health. But it's not necessary or protocol for the whole employer to be notified. It's a very surgical sort of process where the contacts with that positive case are directly notified.
Thank you, Tajma. To Robert Chappell from Madison 365. Robert? And a reminder, *6 to mute and unmute your phones. Madison 365. Okay, moving on then to Molly Beck from the Milwaukee Journal-Sentinel. Molly?
Thanks for having this call again. Governor, what's the unrelated package you're working on? What's the total cost of that legislation? And will it include funding for hospitals, restaurants, and other businesses?
We're still in discussions on that point, and so I'm unable to provide that information, but we are in discussions with legislative leaders and folks in the legislative world on that, but we don't have a total cost yet.
Okay, to Jeremy from Urban Milwaukee. Jeremy?
Question on the testing process. How are numbers compiled from the testing process to the reporting process? I know the numbers are snapshot of time, but do all 72 counties report at the same time?
Are you talking about their results on their tests?
The numbers of state reports, the 457.
Got it. So those results come back to us from the labs who are doing the tests, and then it's pushed out to providers and to local public health departments where those where those results reside. And so it's not a process where the counties notify us, but we notify local public health based on the results that come back to us from the labs that are doing the testing.
Thank you for that, Jeremy. To Victor from CBS 58 in Milwaukee. Victor?
Thank you for taking the call. This is kind of touched on earlier. We were talking about rent payments, but I guess specifically what's being considered with eviction as that being, as we're approaching end of March, beginning of April. There's some court cases kind of moving through the system and kind of halted. But I guess what's happening in capital to address eviction specifically?
Sure, I can answer that question. As something that we're taking a very close look at, obviously, due to the public health situation, having somebody being evicted from their home while at the same time with issuing an order telling people that it's safer to be at home is problematic. And so that is something that we're taking a very hard look at to see what steps can be taken to ensure that people do have a safe place to be during the public health emergency.
Thank you, Victor. To Amy DuPont from Fox 6 in Milwaukee. Amy?
Thank you. This is for the governor, for Mr. Milton. What does the appeals process look like for businesses not considered essential but who believe they are, and will they be allowed to operate during that process?
So the process is fairly straightforward. One of the things that we learned from other states, one of the benefits that Wisconsin had about in terms of when we issued the order, as the governor said, by issuing it today, we were able to gather more input from the business community, from our counterparts in other states. And one of the benefits or areas we saw that could be improved was having a set process where people can, even if they're not on mentioned in the order or on determined by the federal government to be essential business, that they can submit an inquiry with the Wisconsin Economic Development Corporation on their website, and the Wisconsin Economic Development Corporation will be able to make that final determination for them. And I think that's important because it provides certainty for people, and also it's one of the lessons we learned where, especially with supply chains, as the governor mentioned, one of the problems we saw with the Pennsylvania order was one of the Wisconsin utilities wasn't able to get a critical part from a Pennsylvania manufacturer because it just had broad categories of folks who were exempted. We have a much more nuanced and thoughtful approach here, and that's going to be able to take into account situations just like that, where people, even if they're not on this comprehensive list, they'll be able to seek clarification from WEDC.
Thank you, Amy. Ben Jordan now from TMJ4 in Milwaukee. Ben? Ben from TMJ.
Hello, and thank you for taking my call. What would you tell business owners who find themselves in a gray area in regard to this order? An example being a massage parlor, where the order says day spa is not essential, but massage therapy is.
Again, as I mentioned earlier, in terms of the ability to go to the WEDC to do an inquiry, that said, we're also continuously soliciting feedback. We're getting feedback both directly from business owners, but then also from the legislature and from others, and we will be continuously updating the frequently asked question page to be able to provide clarification on issues just like that.
Now to Nick Bohr from WISN in Milwaukee. Nick? WISN. Okay, we'll move on. And our final question today comes from Mariela Munoz from Wisconsin 38. Mariela? And a reminder, *6 to mute and unmute your phones. Mariela? Okay, and with that, we're wrapping up today's media briefing. Thank you for joining us today. Any additional questions that you can be emailed to dhsmedia@dhs.wisconsin.gov or by calling the media line at 608-266-1683. Also, a reminder to continue to monitor the DHS Outbreaks and Investigations page and the COVID-19 page at dhs.wisconsin.gov for updates on this pandemic.
And you've been watching the Evers administration issuance of a statewide safer at home order. Governor stating at the start of this that he did not want to have to do this, but this is a fluid situation with COVID-19 and he simply had to listen to the experts to keep the people of this state safe. He's calling on everyone to embrace what he calls Wisconsin values of kindness, compassion, empathy, and respect. And he says the bottom line is the need is for everyone to limit their interaction with others. So that means no play dates, no dinner parties, no potlucks, at least for the next month. This is in effect, this stay at home, safer at home, I should say, is in effect March 25th through April 24th. Also got some updated numbers, 457 positive COVID-19 cases now in the state, 5 deaths so far. And according to the Wisconsin Department of Health Services, they say by April 9th, if nothing would be done, experts predict using models from Italy and China, that if nothing was done, no safer at home, no restrictions, no closures, Wisconsin could have more than 2,200 confirmed cases and between 450 and 1,400 deaths. That would be by April 9th if nothing was done. That was everybody's reasoning today in explaining why this safer at home order is now in place, effective tomorrow, 8 a.m. through April 24th. We will have much more coverage tonight, starting with Action 2 News at 4. Now back to regular programming.
Download the free app today for a $20 welcome bonus.
What's up with Tammy?
She's in York mode, savoring dark chocolate and cool, refreshing peppermint.
Can someone hop on this call?
Me. And now introducing York Thins, the York you love, just thinner.
And Doug.
Give me your hand! I can save you! Lots of money with Liberty Mutual! We customize your car insurance so you only pay for what you need!
Only pay for what you need.
Liberty, 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 liberty.
Morning, sleepyhead. You want to help?
Yeah. Yeah, I thought we ran out of Daisy last night.
We did. You know, it's not the same without it.
Now we can eat.
My little brother?
He's like, good morning.
Daisy. The Bachelor.
I am on top of the world right now.
The Bachelorette.
I'm falling in love with you.
Bachelor in Paradise. Monday, April 13th, comes the next chapter in the Bachelor journey.
Welcome to Listen to Your Heart.
Listen to your heart.
20 single musicians.
This is magical right here.
Step inside the Bachelor mansion.
I'm here to have music bring me together with someone.
Looking for a love that's off the charts.
I almost felt emotional watching you sing.
We literally fell in love over a song. Oh, God, I just hope he doesn't hate me.
It's just like a real life Star is Born.
You two have a clear connection.
It was sexy, it was passionate.
Who is here for the right reasons?
I am falling in love.
And who's here for the song reasons?
No fun singing a love song when you're not in love.
The Bachelor presents Listen to Your Heart, a 6-episode event, Monday, April 13th on ABC.
In this uncertain time, there is one thing we all know for sure. Cooking is a way to heal and bring people together. For many people feeling overwhelmed in the kitchen, have no fear, because joining us now via remote is chef and partner of the Lambs Club, Jeffrey Zakarian, along with his wife, Margaret, and his daughters, Madeline and Anna. So thanks for being with us. We really appreciate it. And Jeffrey, first off, how are you and your family doing? How have you been adjusting to this new normal?
Well, thank you for letting us beam in from our home. We're fine. I've enlisted 2 sous chefs here, Madeline and Anna. My wife is the producer. So we're all working very hard to bring some joy to families, and we're trying to work with what you have in the pantry and what might work for you.
I love that.
So what we have today is Go ahead.
No, well, I wanted to get in before we get into the recipe because this is really
Yes.
important stuff, and I know this is very meaningful to you. You are on the board of City Harvest, and you're chairman of the Food Council in New York. So how can people help with hunger relief right now? Because not everybody has a stacked pantry.
Yeah, you know what we do, City Harvest is the largest food rescue organization, and Governor Cuomo has designated as an essential service during this pandemic. That's really important because we would